Good evening and welcome to another wonderful episode of the Wonderful Family Moms Community Class. Today we'll be talking about prenatal care and prenatal tests, and I'm sure you are going to enjoy it so much after our last discussion on infertility. But before that, I would just give a brief overview on premarital tests, which is most likely done before you even start prenatal tests. Premarital tests are done before someone gets married, and it's good to do them. Tests like for HIV, STIs like gonorrhea, syphilis, bacterial vaginosis, and warts. And tests of the blood group to check your rhesus factor, genotype tests, fertility tests like we talked about last week, including semen analysis, ovulation test, pelvic ultrasound, hormonal tests for both couples. Then test for possible genetic or chronic conditions like diabetes, hypertension, and the rest. So these are the premarital tests that are actually good for one to do before you decide to spend the rest of your life with someone. So let's go directly to prenatal care, which has to do with the care you get before birth. Prenatal. Natal means birth, so before birth. What is it? This is the care you get when you go for checkups from your doctor, your nurse, or your midwife throughout your pregnancy, from beginning to the end. It helps keep you and your baby, your future baby, healthy. So doing this, when you go for prenatal care, you most likely do some routine tests, and you also learn about how to ease any discomfort you have with your baby. So this is also a form of prenatal care we are doing, talking to you about your baby, pregnancy, and your baby. And this is something you should start as soon as you know you are pregnant. Most times you have to do prenatal visits or antenatal visits. They mean the same thing. Every 4 to 6 weeks for the first 32 weeks of pregnancy, every 2 or 3 weeks for the next 32 to 37 weeks, and every week from 37 weeks till delivery. You might deliver at 40 weeks, before 40 weeks, or sometime after 40 weeks. So keeping a close look at you during that period is vital. But this frequency could be more than this. We have given frequency for a normal delivery, someone who is between 18 to 45 years and is very healthy. If you have a high risk pregnancy, or you have a condition which your doctor is managing, you might be seen more often. But what about prenatal tests? These are the medical tests you get during pregnancy and during prenatal care, during prenatal visits. So some of these tests are done several times during pregnancy, and others are done at certain times, just a few times. Or some are even done only if you have certain problems which might affect your health or your baby's health, such as possibility of having birth defects, genetic conditions, or chromosomal conditions. Now, prenatal tests could be screening tests or diagnostic tests. What are screening tests? These are tests that are done to check if your baby is more likely to have a health condition, but they are not sure if the baby has the condition. It's only checking, like, to know the probability, how risky, high risk or low risk is it. While diagnostic tests tell if your baby actually has the condition or not. This confirms the result of the screening test. So you might be asked to do a screening test first. Then if there is likelihood of your baby having it, a diagnostic test might be done to confirm it. So when you decide to have a screening test, you'll be able to learn more about your baby's condition, if there is any, and how you'll be able to care for it before the baby is born. So this gives one an opportunity to plan ahead of anything that could happen. What tests do you get all through your pregnancy? The major tests you get several times during pregnancy, like every time you go to the hospital for your prenatal checkups, or antenatal checkups, you might have this test done every time. like your blood pressure is checked all the time, and this is because you want to be sure you do not have a condition called preeclampsia, in which there is increased blood pressure and protein in the urine, something that should not be in your urine might be noticed. So the test is done regularly to be sure it is not there, because we do not want you or your baby to go through any complications because of not doing it. And also urine test, like I mentioned, to check for protein in the urine or to check for infections like in the bladder or in the kidney. These are done all the time. And also blood tests might be done frequently to check for certain infections like syphilis, HIV, hepatitis B. And not leaving out the blood type, like we mentioned for premarital test, the blood type and the rhesus factor. These two are very important, to know your blood group and your rhesus factor, because this is something that could affect baby. If you are a rhesus negative mother and your husband is a rhesus positive person, that's what the RH is about, negative positive. You might be having a baby who is rhesus positive, and this could affect your ability to have other children. It could even affect the present pregnancy. So it's something that is good to know early what it is. And they might also check for anemia as they are doing the blood test. So now we are going to break down the tests you do into each trimester. What prenatal tests do you do in the first trimester, in the second trimester, and in the third trimester? So in the first trimester, which is referring to months 1, 2, and 3 of your pregnancy, so that's why it is good for you to register early, so that you do all these tests and be sure everything is fine, and you even get to see and bond with your baby better. Most common of all is ultrasound, popularly called pregnancy scan. So this can be done very early to be sure you are pregnant, or to be able to, and also to be able to count or date the pregnancy, to know when you actually got pregnant, how many weeks the baby is, so that you will know how far gone you are and when is your most likely time to deliver, your due delivery date. So when you also do the scan at about 12 weeks, you could see the genitals of the baby and see what gender or sex of baby you are having, but this is not always possible. So it might, depending on the position in which the baby is lying, they might not be able to see it, but the likelihood of them seeing it if the baby is lying in a good position is high. And also first trimester screening, which includes your blood tests and an ultrasound, like what we talked about before, the rhesus test, your blood group, and genotype might be done. So around 11 to 14 weeks, it's good to do this. And also other screening tests like carrier screening for genetic conditions might be done for some conditions, such as some medical conditions such as thalassemia, hemoglobinopathy, some conditions that might affect the blood cells. So, and another one called fragile, something condition which could lead to autism. So there might be need to do this, because especially if it runs in your family or within the ethnic group where you come from, you'll be advised to do this test. Other ones include cell-free fetal DNA testing of the baby. It might be done to check if the baby has some certain conditions, but only if an ultrasound which you did first shows that the baby might have a birth defect. That is when you'll be advised to do this. So if there's nothing showing that, you might not be advised to do this. And they could also ask that you do a test called amniocentesis to confirm this result. So it's like stage by stage. The screening test comes first, then if everything is fine, you continue with the other tests later. But if there is a cause for alarm or needs to confirm something, you might be asked to do a diagnostic test to confirm. And also another test called chorionic villus sampling, CVS. So this helps to check if your baby has a genetic condition like Down syndrome. I'm sure you've heard of it, or you've seen some children that have that condition. So if you are older than 35, or this genetic condition runs in your family, you might be asked to do this, because it shows that that person is at an increased risk of having a baby with birth defects. So you might be asked to do this to be sure you don't have it, or if there is, what can be done early. Then in the second trimester, moving on to the second trimester, what tests are done between months 4, 5, and 6 of pregnancy. You will be doing a maternal blood screening. That is about 4 tests done, checking for 4 different substances in the blood: AFP, HCG, and 2 others. That's alpha fetoprotein, human chorionic gonadotrophin, estrol, and inhibin A. They are usually done between 15 to 22 weeks of pregnancy. And if you remember, I mentioned a test called amniocentesis, which you might be asked to do depending on what test you did in the first trimester. This is usually done in the second trimester, between 15 to 20 weeks, to diagnose, checking the amniotic fluid, to check if the baby has a birth defect or a genetic condition or not. So this would only be advised if you did a screening test before that shows there's a high likelihood of the baby having it. And an ultrasound will be done again. So like at every trimester, you have to do an ultrasound. Usually done between 16 to 20 weeks. You'll be able to check the baby's growth and to check if there is no birth defect. Then a glucose screening test. This is to see if you, the mother, do not have gestational diabetes. That's a sort of diabetes that occurs during pregnancy. So they'll do this. It's done between 24 to 28 weeks. So it falls in between your months 4, 5, and 6. And finally, the third trimester. What tests are usually done? Not many tests are done, but majorly a test called GBS, Group B strep, is usually done. It is done to check for infection, so that you do not pass infection to your baby during delivery, during birth. So, and this is done between 35 to 37 weeks, like we said, between month 7 to month 9, the final time of delivery. So this GBS can cause infection, which could affect the baby on delivery. If not noticed early, it could cause meningitis, pneumonia, sepsis, or other conditions for the baby. So that's why it's good to do it, so that they'll be able to treat it if it is there, and prevent the baby from having any of these conditions, which could be life-threatening or cause complications for that baby. And one important thing, which is not actually a test which they have to take sample or something, it's something you yourself do. Okay, you are also testing yourself, and you'll be taught how to do it, is to count the fetal kick. Yes, the fetal kick. This is done to check, for you to know how often your baby moves. And by about 5 months, by about the second trimester to the third trimester, you keep doing this fetal kick count. So you try to take note of how many times the baby moves in an hour. But how can you do that? You might be wondering. We'll give you an overview of it. Science has shown that most babies are usually active between 9 a.m. and 1 p.m. and around this time most mothers are usually resting, so you could be resting and be able to check. So it's just a speculation. You yourself can use this to find out when your baby is most active, so you use that time to check the fetal kick counts and to chart it. Yes, so what you should be looking out for is that the baby kicks frequently, at least 10 times in 2 hours. If it is not up to 10 times in 2 hours, it's a cause for concern. So as you begin to check it, you'll be able to identify patterns. You know when the baby is asleep, you know when the baby is awake, and from there you know when to actually count the kicks of the baby. So if, like we said, it is not up to 10 times in 2 hours, you need to be worried, and not so worried, but most especially if the baby was having more kicks than that before, and suddenly you notice that there is a change. Yes, you could try to eat, drink, or do some activities and check again to see for the next 1-2 hours and count again. So if after this the baby is still not moving, then you might need to contact your healthcare provider, contact your doctor, contact your midwife if you're using a maternity center. Yes. So this could be because the baby is not getting enough oxygen. This could also be because the position of the baby has changed, maybe to like a breech, when the baby's head and the buttocks are lying this way on the side, instead of the baby to be lying in vertical, it's lying this way across your body. So this might not allow the baby to be able to kick up because there's no enough room for the baby. And it might also be that the baby has died in the womb. So this is why it's important to inform your healthcare provider, because you cannot tell. If after some time you notice this, please inform your healthcare provider so they know the next thing to do. If the baby is not getting enough oxygen, they might put you through some supportive measures that would help to release that or check, or they might even decide to deliver the baby earlier than required to save the baby's life and to save your life. So what are the things you can highlight from our discussion today? That there are some tests which you do during pregnancy, and there are some which you do like several times. Almost every time you go to the hospital, you go for antenatal or prenatal checkup. You get a blood pressure check, you get a urine test check. But there are some that you do at certain times, like once in every trimester, like an ultrasound or some special blood test, or test that they want to use to confirm if the baby has a defect or not. Some you might not even do them at all. Yes, so you might not do them at all, and you might be advised to do them to determine if the baby has some health conditions or not. So it's not by this that you know for yourself which one you should do. It is your healthcare provider that will determine which you do. So we need to ask, like when we had a lot of discussions with a lot of the new moms community mothers, some said they've not registered, they've not started antenatal. Please go and register, start antenatal, do the necessary test, and we can also direct you to the right hospital to use. So all you need to do is contact us, call us, and we will keep you posted on the right healthcare provider to use. And we can also answer any questions you have about pregnancy. So feel free to like, to rewatch the video if you need to take note of the points you need to take note of, to comment, ask questions, and even most importantly, don't keep the knowledge to yourself. Feel free to share the video to other people, both those that are mothers that are pregnant, or those that are intending to get pregnant, or those that are not even married yet that are planning to get married. Like we highlighted some things on premarital tests to do before getting married, and tests they can do after getting married when they want to have babies. So thank you for watching, and we hope to have you comment, like, share. We hope to have you engage with us so that we get to know you better, we get to know what to discuss on another day, which you find very interesting, such as this that we have today. And don't forget to contact One Doctor, call our helpline, chat with us on WhatsApp, and keep you posted on the next discussion we'll have next week. Thank you and have a wonderful day.